Hello everyone, my name is Dr. Shravya. Today we are going to learn about diabetes mellitus, its types, causes, symptoms, screening, diagnosis, treatment, and its complications. Coming to the definition part, diabetes mellitus describes a group of metabolic diseases that are characterized by chronic hyperglycemia. Metabolic disease is nothing but a condition in which the the body's inability to convert food and drink into energy means it disrupts the body's ability to convert food and drink into energy. Here, there is a disturbance in the normal metabolism of the body due to chronic increase in the blood sugar level. Hyperglycemia is nothing but a condition of elevated blood glucose levels. As a blood glucose levels increases, there will be some disruption, some there will be some disturbance in the metabolism, which is called diabetes mellitus. Commonly, diabetes are of two types, type 1 diabetes and type 2 diabetes. Coming to type 1 diabetes, which is a result of an autoimmune response that triggers the destruction of insulin producing beta cells in the pancreas. Here, autoimmune response is nothing but the immune system which attacks the healthy cells. Means the immune system which attacks the healthy cells. Here, it attacks on the insulin producing beta cells. Okay, as there is an attack, there will be the destruction of these cells, which causes insulin deficiency. Okay, here insulin is nothing but a hormone that is secreted by islets of Langerhans in pancreas, which control the level of glucose in the blood. It controls the level of glucose in the blood. As there is an autoimmune response, means it destroys the insulin producing beta cells, means the immune system itself attack on the insulin producing beta cells, and it causes the destruction of these cells, which results in the insulin deficiency. By this we'll get type 1 diabetes. Okay, coming to the onset, which gradually occurs during the childhood with an acute onset. Okay, type 2 diabetes mellitus. Coming to type 2 diabetes, which is more common and has a strong genetic component as well as the significant association with obesity and sedentary lifestyle. Here, the sedentary lifestyle and the obesity are the risk factors for type 2 diabetes. Many of the people, out of 10, 9 are suffering from type 2 diabetes nowadays. Nowadays, it has become a common issue and the most important disease in our day-to-day life. And it is characterized by insulin resistance and impaired insulin secretion due to pancreatic beta cell dysfunction, which results in insulin deficiency. Means there is an inability of a cells to respond adequately to insulin, which causes inhibited glucose uptake from the bloodstream. This is about the definition part of diabetes mellitus and its types and its definitions. Coming to etiology, type 1 diabetes etiology. Autoimmune destruction of pancreatic beta cells in genetically susceptible individuals is a most common cause for type 1 diabetes. And HLA association. HLA is nothing but human leukocyte antigen. Here HLA-DR3 and HLA-DR4 are the specific allele of major class 2 histocompatibility complex. Histocompatibility complex is group of genes on DNA that code for cell surface proteins. Okay, these HLA-DR3 and HLA-DR4 positive patients are at increased risk for developing type 1 diabetes. This is how it is one of the cause for type 1 diabetes. And coming to some of the autoimmune condition which are also associated with the etiology of type 1 diabetes. Those are Hashimoto-thyroiditis, type A gastritis, celiac disease, primary adrenal insufficiency. Coming to type 2 diabetes mellitus risk factors, means those are the risk factors which cause diabetes. One is family history, high risk race or ethnicity, dyslipidemia, pre-diabetes, physical inactivity, cardiovascular disease. PCOD, hypertension, history of gestational diabetes, and overusage of medications like glucocorticoids, statins, some HIV medications. These are the risk factors for type 2 diabetes. Coming to family history, the first degree relative with diabetes are more risk for type 2 diabetes. First degree relatives means the bloodline relatives, okay? Means parents, full siblings, etc. The first degree relative are the uh, first risk factor for type 2 diabetes mellitus. Coming to clinical features of diabetes, first, type 1 diabetes onset. It is sudden in onset, and diabetic ketoacidosis is a first manifestation in 25 to 50% of the cases, and some of the children may present with acute illness and classical symptoms. Coming to the classical symptoms of hyperglycemia, means classical symptoms of increased blood glucose levels are polyuria, polydipsia, polyphagia. Coming to polyuria, which can lead polyuria mean which can lead to secondary enuresis and nocturia in children. Polyuria is nothing but the abnormal production of urine. Means literally they pass more than 3 liters of urine in a day. Coming to polydipsia. Polydipsia is nothing but excessive thirst. Polyphagia is excessive hunger. And unexplained weight loss will be there. There will be the blurred vision. And people suffer from some poor wound healing situations. And there will be the fatigue and cough cramps are seen in the people or in the patients with type 1 diabetes, and there is the increased susceptibility to infections. Here they are more prone to infections. Coming to type 2 diabetes, clinical features, uh, typically gradually in onset, and a majority of the patients are asymptomatic. They do not uh, present with any symptoms for many years. Okay, the majority of the patients are asymptomatic for many years, and some patient may present with hyperglycemic crisis. Hyperglycemic crisis means it is nothing but hyperglycemic crisis is nothing but complications of diabetes characterized by severe hyperglycemia. Okay, severe hyperglycemia like polyuria, polydipsia, polyphagia, and blurred vision, fatigue, pruritus, poor wound healing. These are also symptoms seen in type 2 diabetes mellitus. These are the classical symptoms of increased blood sugar level, which is seen both in type 1 diabetes and type 2 diabetes. Coming to screening part of diabetes. Okay, the people get the doubt when we should go for screening. At what age we should go for screening for diabetes means the indications here included are all the individuals more than 35 years of age should undergo for screening for diabetes. Okay, then the patients below 35 years of age should undergo screening when they are overweight or obese, first degree relative with diabetes, like parents with diabetes and all siblings with diabetes. Next, high risk race. Next, the people with physical inactivity, with cardiovascular diseases, or the people suffering from PCODs, hypertension, etc. And the people with severe obese, like over in weight, obesity people, they should undergo for screening. Coming to diagnosis part of the diabetic diabetes mellitus. Here, the diagnostic criteria include random blood glucose levels, fasting plasma glucose, oral glucose tolerance test, and hemoglobin A1C. Coming to random blood glucose. Here, the random blood glucose levels are more than 200 milligrams per deciliter in patients with symptoms of hyperglycemia. Here, the blood glucose levels are more than 200. Okay, these tests can measured at any time irrespective of recent meals. Coming to plasma glucose, fasting plasma glucose, here blood glucose measured only after 8 hours of fasting. Coming to oral glucose tolerance test, here the measurement of fasting plasma glucose and blood glucose only after 2 hours of food consumption. Okay. In the second step, it is used in diagnosis of gestational diabetes. Coming to hemoglobin A1C, which is a glycated hemoglobin which reflects the average blood glucose levels of the prior 8 to 12 weeks. Here we'll get the blood sugar measurement of before 8 to 12 weeks. For 8 to 12 weeks of measurement we'll get. It can be measured at any time. Coming to the management of diabetes, what are the general principles? What is the main goal? How we can manage diabetes means first we need to control the blood glucose level or blood sugar. We need to control the blood glucose level. Next, the patients with type 1 diabetes always require insulin therapy. They need insulin therapy. Next, type 2 diabetes can be managed by non-insulin anti-diabetics. They can manage by non-insulin anti-diabetics, but type 1 diabetes need insulin therapy. And acute illness may require temporary changes in treatment, like increased insulin demand due to acute stress reaction. Okay, the main goal is here to control the blood glucose. Coming to comprehensive diabetes care, means all the patients should maintain like balanced diet. They need to change their lifestyle, food habits. They need to control their weight. They need to get regular exercise. They need to get proper nutrition, and they should quit the smoking, and they need to go for routine screening for microvascular complications of diabetes. This is how the management process includes. Coming to anti-hyperglycemic treatment. Okay, the treatment for type 1 diabetes mellitus is mostly the insulin replacement therapy and multiple daily injections. Insulin injection should be taken, and insulin pump is considered for most of the patients. Okay, here the type 1 diabetes mellitus require the insulin replacement therapy like multiple daily injection doses. Coming to type 2 diabetes, the most people suffer from type 2 diabetes only. Mainly the people suffer from type 2 diabetes. Out of 10 people, 9 people are suffering with type 2 diabetes. How to start the treatment for type 2? Start the treatment in all patients at diagnosis level only. When they are diagnosed with type 2 diabetes, immediately they need to start with the treatment. Here, monotherapy with metformin is the first line of treatment for most of the patient. Metformin is the first line of treatment for most of the patients. This is how the treatment is for type 1 diabetes and type 2 diabetes. Coming to complications. Okay, what are the complications for diabetes? Here it includes acute complications and chronic complications. Coming to acute complications, there will be the hyperglycemic crisis, means the complications of diabetes which are characterized by severe hyperglycemia. Like when these are undiagnosed or insufficiently treated, diabetes mellitus may result in severe hyperglycemia, potentially accumulating in a crisis. When these symptoms like polydipsia, polyuria, fatigue, polyphagia, unexplained weight loss, pruritus, poor wound healing, when these symptoms are undiagnosed, when these symptoms are undiagnosed or insufficiently treated, we'll get the diabetes mellitus may result in severe hyperglycemia. Means the severity of the symptoms increases, which causes hyperglycemic crisis, and it causes hyper uh, hyperosmolar hyperglycemic state, means the condition of primarily seen in type 2 diabetes due to extreme hyperglycemia. It is also caused due to extreme hyperglycemia only. Next, life threatening hypoglycemia, which is secondary to inappropriate insulin therapy. Next, diabetic ketoacidosis. Coming to chronic complications, here we see necrobiosis lipodica. It is one of the chronic complication which is seen in diabetes. Here there will be having collagen degeneration and lipid accumulation on the surface of the skin. Here in the picture you can see the Collagen degeneration, lipid accumulation over the surface of the skin. Actually, it is an inflammatory granulomatous disorder of the skin. It is a skin disorder in which collagen degeneration, lipid accumulation is seen. In this picture, you can have a look. You can have a look in this picture. Coming to macrovascular diseases like coronary heart disease, cerebrovascular disease, and peripheral artery disease, gangrene. These are chronic complications, microvascular diseases of diabetes. Coming to microvascular diseases like diabetic nephropathy, diabetic retinopathy, diabetic neuropathy, and diabetic foot. These are the um, microvascular diseases like which are typically arises after 5 to 10 years of the onset of the disease. After 5 to 10 years of improper diagnosis or improper treatment leads to diabetic nephropathy, diabetic retinopathy, and neuropathy, and diabetic foot. This is how the complications arises for diabetes if untreated properly or undiagnosed properly for many years. Okay. uh, this is how will this is how the diabetes is treated. This is how the diabetes mellitus is treated by anti-hyperglycemic treatment like type 2 diabetes mellitus need metformin, and this is how we learned about the diabetes mellitus, its causes, types, screening part, diagnosis, treatment, and complications. We have gone through complications also. And thank you everyone for watching my video till the end. If you people find it useful, please like, share, subscribe to my channel for further videos. Thank you once again.